Hello everyone. I am Sanjana, onco nutritionist from ZenOnco.io. Today we shall be speaking on a topic which is called as cancer cachexia. Now, patients who are having cancer are at a high risk of malnutrition, which could be because of the disease or also because of the treatment which they are undergoing. This can lead to a reduction in their nutritional status as well. Actually, it is very important to understand the difference between the term cancer related malnutrition and cancer cachexia. Let us try and understand what are each of these mean. Now, disease related malnutrition is defined as a condition which will result from the activation of the systemic inflammation or by an underlying disease itself, which is cancer. Now, what is cancer cachexia? Cancer cachexia is a multifaceted syndrome and it is characterized by systemic inflammation. There is loss of lean body mass with or without the loss of fat mass itself, and there is also a negative energy and a protein balance in the body. So the body undergoes through a lot of catabolic changes and physiological changes as well in cancer cachexia. So generally we can see that there are abnormalities in the fat metabolism, protein metabolism, and also the carbohydrate metabolism as well. Now, it is also important to understand what is the three-step classification of cachexia. So, first we look at what is called as pre-cachexic phase. Now, in this, the patient is having a weight loss of less than 5% only, but they have not developed the serious complications as of now. And cachexia is wherein the syndrome is progressing and the weight loss is exceeding to the above mentioned parameters, but yes, it can be potentially treated. Next is the refractory cachexia. This is the point wherein the patient is also at a risk, or the body has not been responding to any sort of a treatment, and due to which we say that they have to be undergoing a palliative care, which is a supportive care. Now, mainly medical nutrition care will depend upon the patient's nutritional and also the metabolic needs. So let us try and understand what exactly nutrition support we need to give for the three-step classification of cancer cachexia. Now, in the pre-cachexic phase, the weight loss is less than 5%. There is loss of appetite or anorexia, and there are also metabolic changes which are seen in the body. Now, during this time, it is very important to give a detailed nutritional counseling to the patient. Okay, you can also give them food which is fortified with the essential micronutrients or the macronutrients. Try incorporating more of anti-inflammatory, antioxidant foods, and also ensure that they have adequate protein intake. And we can also give them oral nutrition supplement which is going to give them that additional nutrition support as well. Now, next we move ahead to see cachexia. Over here, we see that the weight loss is more than 5%. The BMI of the patient is less than 20 kg per meter square. So now, mainly the thing is in the cachexic phase, as we see that there is a loss of lean body mass, there is a negative protein and energy balance, there is some amount of systemic inflammation which is also happening. So now the patient needs to be given also a oral nutritional supplement during this time. And certain patients, because of the treatment which they're undergoing due to cancer, they might experience a loss of appetite as well. So if you are going to see that the intake of the patient is less than 50% of their requirements, then yes, we need to consider giving them an alternative feeding method, which is enteral feeds, which is tube feeding with adequate energy and protein as well, so that it can suffice their requirements as well. And once you see that their nutritional intake has increased to more than 50%, then we can bring back the patient on oral nutrition without refractory cachexia. Over here, there is a lot of catabolism which is occurring within the body. Now, when I refer to catabolism, it means that there is breakdown of the nutrients, the important compounds in the body. The body is not being responding to any kind of treatment as well. So the survival of the patient will also be told by the doctor. During this time, as a nutritionist, what we can do best is to give them palliative nutrition support, so that we can help them to reduce the feeling of hunger and also thirst. So to conclude, yes, cancer cachexia will also lead to a decline in the food intake as well, and it can also put the patient at a risk of malnutrition also. It is very important to understand and recognize the clinical signs and symptoms of such patients, and to give them the timely intervention also, so that we can ensure that their overall health is going to gradually improve. So thank you for watching. We at ZenOnco are always by your side, offering the support and guidance to navigate you through your cancer journey. For help regarding cancer, you can surely connect with our cancer coaches on the below mentioned contact number. Thank you.